It was rather upsetting to read the news from the BC government that the opioid crisis during the pandemic has only gotten worse. More people are dying than before earlier on in the year during the pandemic. In British Columbia, January, February, you had about 75 people a month who were dying tragically of overdose deaths. Now, May, June, July, the numbers are in 175 people a month dying from overdose deaths. Dr. Bonnie Henry in BC, she mused that the idea was rather disappointingly, tragically, ironically, whatever the term is, the social distancing measures are actually being followed, meaning that people are not going to these injection sites and they are not doing drugs with a friend or somebody else, so there's no one to watch over them if they end up having an overdose. So they are doing drugs alone, they are dying alone. It is tragic. And I think we all need to acknowledge that. This is not a political issue, whether it's a left-wing activist working on the streets there dealing with these issues. President Donald Trump has said we got a crisis on our hands. He's talking about what's going on in America. It has to be dealt with. Here's the thing. We've got to start going in new directions, trying new things. Right now, the leading mantra, and boy, it is a mantra, they stick to it like a talking point. Harm reduction, more safe injection sites, more money for it, and now giving them free drugs. The government acting as the dealer, as I discussed in a recent video, $1.5 million of taxpayer dollars going to a pilot project to give opioids, otherwise the street drugs that these people would be getting on the street, getting them from the government, and they're using them at these injection sites. But a lot of people in medical communities are stepping forward saying, hold on a second, we don't know if this is the path forward. A lot of doctors don't like this talk about client-centered care and so forth. They say they're not clients, they're patients. We have people who have a lot of issues going on. We need to help those people. We need to deal with the underlying issues. That's what some psychologists, psychiatrists are saying, stepping forward. Doctors saying it must be to help, to get them off these drugs. The activists, they say, no, we meet them where they're at. And what they mean by that is if somebody is not interested in going through addiction services, they don't push them. They don't try and encourage them to go there, lest the idea backfire. Okay, whatever your take in all of that, we've got to be open to all different options. And here's another option that we have to explore. We have to get tougher on the dealers. The majority of these overdose deaths in BC, this report says, was fentanyl. This is not marijuana. This is not, your mom and dad's recreational drug from decades ago. Fentanyl is a drug, particularly carfentanil, a variant of it, that can kill you from one single use. And when I say dealers, you know who I'm also talking about? I'm talking about China and the shipments coming in from China full of fentanyl, laced with fentanyl, that are killing Canadian citizens. We have to deal with these issues right now. These numbers are only going to get worse. And the opioid crisis, it's a nonpartisan issue. I think it's something that should concern all Canadians.